I think we're hearing more about Lyme disease, especially if you're from the east of the Rockies, although it's pretty much in all states in the United States now, is because it's becoming more prevalent. Lyme disease itself is a tick-borne illness. It's a spirochete, similar to the same type of bacteria that causes syphilis. One of the great challenges of it is that it lives inside the cell. It's very difficult for the immune system to be able to attack it. And so it becomes a chronic, low-level infection, and it's not just a function of creating a rash or a fever that you would tend to think with routine illnesses. It unfortunately can affect any and all different organ systems, and then you get the very, very wide variety of symptoms. And unfortunately, because there's no really good test to really say whether you have Lyme disease, we use indicators, but it's really more about the patient's history and the fact that you've ruled out most of the other types of things that would cause their symptoms. We have come to this diagnosis of Lyme disease, so it is in sort of epidemic proportion.
Lyme disease is something that normally you'll get a diagnosis with, and the problem with conventional medicine is if you don't have the acute infection, we can't get the diagnosis. So you might have had an infection, just like you might have had mono or you might have had some other infection, but that active phase has long gone. And so your ability to diagnose that, or your ability to look at the immune system and really see that fight is over with. And that lends to the problem of having the chronic infection, is that if your body could have fought it off, you wouldn't be having the discussion. You know, you're supposed to get an infection, your body is supposed to respond with the immune response, and you're supposed to resolve the infection. If you don't resolve the infection, or if there's other competing factors of your immune system to not allow you to resolve the infection, you carry that infection for a long period of time. And even though it might not be acutely debilitating, over time it will drain the batteries so that you end up with a myriad of symptoms, and then you're kind of in this bucket of not being able to get one solid diagnosis because there's no way that you can get the acute blood test back. So that leads people all over the place, because at that time you have multi-system failure, you can't sleep, you can't think, your joints hurt, you have digestive problems, and there's not that many parts in the body that can take a global, we'll say, insult like that and not be affected.
Many of the people who are the most susceptible to experiencing the unfortunate symptoms associated with Lyme, at the time that they're exposed, are probably out of balance in the first place, because we also know that there's tens of thousands of people who have also been exposed to the same ticks, to the same spirochetes, to the same co-infections, who are not ill. And instead of saying, well, why are you sick, we should say, well, why aren't you sick? And it's the variety of different types of things that are going on, and that's why we say it's important to look at an individual's diet if you have Lyme disease. It's important to look how your lymphatic system is working, because it's one of your main detox systems. How does your digestive system work? How is your liver functioning? Are your hormones in balance? Are you sleeping okay? Is your nervous system agitated? Are your probiotics in the right balance? And then that group will lead us to a different therapeutic approach.
We have, technology that basically bolsters the electricity in the body, increases the oxygenation of the body, drains the lymphatic system, deals with the digestive tract. We do IV therapy to basically get micronutrient levels high, ozone therapy to knock infections down and oxygenate the body, neurofeedback to make sure the central nervous system is responding as well as we can. I mean, there's so many different things that you want to tie into, and does a person need to do all of those? No, but the point is you come, and we also have a whole bunch of diagnostic and analytic machines that tell us where the holes in the bucket are so that we can tailor the best possible treatments.
We treat Lyme by looking at all your organ systems in the clinic so that we can ultimately individualize the right treatment plan for you. So for the most part, antibiotics is really not a part of that, mainly because the people who come here with it have already done that approach. It hasn't been successful. We find it much help to just repeat what they've already tried when it wasn't successful in the first place. Our goal definitely is to, within the period of time that somebody is here, you're not going to see much within a week period of time, because the physiology of the body really can't change that quickly. However, if people are here for ideally 3 weeks in that type of a scenario, Certainly when we do our objective tests, we can see from start, the middle, at the end, the types of changes that would come. So when we're doing things like IV therapies that can see a rapid change in a lot of the other treatments, the anticipation would be that we will, and from our testing, we will know that we're going in the right direction. Are you cured? No, definitely not, but we can then give you an at-home program that will facilitate you to continue the treatments that you get here in the clinic on a positive way.
The goal is not to focus on pathology. The goal is always to focus on functionality and say, I've got a lot to work with here, and I know what I have to work with is not going to be great. So instead of me going and looking for that needle in the haystack, I'd rather focus on the 99% of the rest of the body and say, what do I have that I know that is malleable that I can work with and make as good as I can? And then I'll leave the 1% up, because the best treatment that you have for any chronic infection is still your own immune system. The best treatment that you have for cancer is your own immune system. There's nothing you're going to get more sophisticated than what your body already has to deal with it. What you're trying to do with treatment is you're trying to stimulate that part of your immune system to get a little bit more out of it. But it's very rare that you'll find a treatment that can do what your body can do.